session, nurse educator Leanne Lancaster demonstrates how to conduct a patient assessment at a glance.
You recall your nursing process, which is assessment, planning, implementation and evaluation. Yep. Assessment's the first step in that nursing process. It doesn't matter whether you walk into a ward with patients or whether a patient's coming into a room to see you. We do a basic across-the-room assessment to start with. I think Sarah's just coming back from the bathroom now, so we might observe her as she comes back to her bed.
Your first impression of the patient begins as you observe them from across the room.
Okay, so tell me what you noticed about Sarah and the way in which she made her way back to the bed.
Sarah had an unsteady gait. She had a bit of a limp on one side and was quite short of breath just on that small journey, and she was bracing herself on the end of the bed to try and regain her breath. And then when she was sitting on the end of the bed, she's using accessory muscles to help with the effort of breathing.
Sarah's actually had a CVA in the past, so she does have a little bit of a limp on that right side and difficulty with a bit of walking at times. She also has a history of airway problems, airways disease, long-standing history. So her accessory muscle use is to help improve her breathing and thereby gas exchange. And the position she actually took up on the end of the bed then was what we call a tripod position. That position allows the chest to open up more with the aid of gravity, so that it makes it easier and decreases the work of breathing. Yeah. So simply from looking at...
Your first impressions are important as they will guide your assessment.
So we might head over to Sarah and have a bit of a chat to her.
After you have gained a first impression from across the room, approach the patient and continue the assessment.
Hello, Sarah. Hi. You remember me? I'm Leanne, the nurse educator here.
Hi, dear.
And this is Jo, one of our...
As a priority, you should assess your patient's airway, breathing and circulation, the ABC or primary survey. If at this stage you find a problem, you should treat the patient immediately.
So Jo, when you actually come across to talk to your patient, it's always a good idea to introduce yourself, say, "Hi, I'm Leanne, I'm your nurse for today." Sarah's actually responded appropriately to me, made good eye contact. I've been able to hold her hand. Human touch is always a good thing. And at the same time, I've been able to assess her skin, her pulses. So that way I can tell that her ABCs are intact.
After you have assessed your patient's ABC, take their vital signs. At the same time, observe their general appearance, skin and wound healing.
I've also got hold of her hand where I can feel a pulse if I want, look at her skin, make sure she's not dehydrated, as well as see if there's any lesions or problems with wound healing. I'm also able to see that Sarah's had a shower today. It's quite comfortable in the way she's dressed. As also tell with body odours, not that you've got any body odours, Sarah, but sometimes if a patient has sweet smelling breath, what might that be an indication of?
Is that like diabetes?
Yeah. You can have sweet smelling breath, ketones on the breath, diabetes, that's another underlying problem. Sometimes...
Finishing the patient assessment at a glance involves documenting and summarising your findings, as well as making referrals to other members of the healthcare team, such as physiotherapists, occupational therapists, speech pathologists and dietitians. Now that you have done a general assessment of your patient, you will proceed to perform a more detailed assessment.
So we might have a chat to you a bit longer now, Sarah, if that's okay. How are you feeling today?